One thing that has just not changed is the underfunding. For the government, we worked out what it costs, and we worked out they underpay us by £247 for every person for every week. We need money. We're a charity, we don't make a profit, but we have to have money to reinvest back. We have to refurb the building, we have to decorate things, and then we don't pay people what they're worth. And it's criminal.
Hello everybody, and welcome to this first episode of our podcast series in association with Markel. The title of the series is The Care Sector, Navigating Turbulent Times. So, my name's Liz Jones. I'm the Policy Director at the National Care Forum. We're a membership organisation for the not-for-profit care and support sector. And we work very closely with Markel. And we're delighted that they continue to be the sponsors of the Third Sector Care Awards, which is how we know them so well. Today, we're delving into social care, exploring some of the hot topics, and really helping to explain why social care matters so much, and why it's so important that we work together to address some of the challenges that we're facing. So, with me, an esteemed panel. Let me introduce my colleagues. On my left, we have Claire. Do you want to introduce yourself, Claire?
Oh, hi, I'm Claire. I'm Claire Intool. I'm the CEO of Chefcare. We're a non-profit big provider in Sheffield.
And on my right,
I'm Anita Astor. I'm the Managing Director of Wrenhall Nursing Home, which is a small family-owned care home supporting 54 people who are living with a dementia and have nursing needs.
and on my far right,
Charlotte Rowe. I'm the Care Practice Manager of Markel Care Practitioners. We are Markel's in-house health and social care consultancy.
thank you. Welcome. Thank you for joining us. So, I'm just going to give this a little bit of a wave. This is the report that Markel commissioned into examining in more detail some of the issues that a range of their customers and other stakeholders were experiencing. And so we've got some themes emerging from this report, but some of the key issues that were explored in the report were things that were familiar to us pre-COVID, but which also have been exacerbated by the challenges of the pandemic and the consequences of the pandemic. So there were a whole range of issues, obviously relating to the human factors, the very human factors for all of those families affected, and the people in care settings, particularly in care homes, are affected. But also, of course, the staff who were working very hard throughout the pandemic in very challenging times to continue to support those people and their families. Before we dive into our podcast discussion, let's just think a little bit about what those pre-COVID vulnerabilities for the sector were. So back in 2019, we were still in a period of austerity for local government and funding for social care. We had workforce pressures still, with increasing competition for our workforce from other sectors such as hospitality and retail, and also the healthcare sector. And we had a challenge, which I think we still have, around the public perception of social care. The value that we place as a society on the essential care and support that millions of people need to live their best lives. Somehow we're struggling to help the public understand the value of that and the value of people that work in social care. So those things were all a challenge before the pandemic hit. I think it's worth saying that although the pandemic was a pretty terrible experience for many people, not just people in social care, one of the things that shone through from our sector was the resilience of our workforce and the organisations continuing to try and provide care and support in the absence of for quite a period of time, in the absence of support and guidance and practical help from the government. So I think we should pay tribute to all those colleagues who tried their very best throughout the whole pandemic to continue to provide the support and care that they were doing in very challenging circumstances. And the pandemic also brought an acceleration of the use of digital technology, ways of connecting more easily, and thinking about better use of remote healthcare and clinical support. So there are some things that we need to retain from the pandemic. But with our colleagues today, I'd like us to explore a bit more some of those pressures that remain from the pandemic. So let's see what our colleagues have to say. I'm going to start with Claire and Anita. So let me start with you, Claire. Can you tell us a little bit more about the staffing and financial funding pressures, I guess, that were there before the pandemic, but certainly potentially have been exacerbated by responding to the pandemic and trying to continue to build that resilient, sustainable care for older people that you provide in Sheffield?
I mean, one thing that has just not changed is the underfunding. And it's woefully underfunding, and it's still woefully underfunded. So we did the fair cost of care exercise. So for the government, we worked out what it costs. And we worked out they underpay us by £247 for every person for every week. So we care for about 530 odd people every year who are funded by the local authority. So they underpay us by £3.4 million. And that's the key to everything, because we need money. We're a charity, we don't make a profit, but we have to have money to reinvest back. We have to refurb the building. We have to decorate things. Things break down. And when they break down, they really break down. A bath costs £8,000. A washing machine costs £10,000. To refurb a bathroom is £20,000. And we've got 9 homes. So you need money just to stand still. You've never got as many staff as you'd love to have. You always want more staff. If you had more money, you'd put more activity workers on, more carers, more staff at night. And then we don't pay people what they're worth. And it's criminal. So money is so important, and it just hasn't changed.
And so for people watching this who don't really understand how the money works in social care, about 70% of care that exists at the moment, that's delivered in England, is paid for by the state. And the other 30%-ish is paid for by people from their own funds, if they have more money than the state thinks is the limit for financial assistance. Out of the people that you support across your 9 homes, have you got a sense of what proportion of those people are funded by the state?
It's about 2/3.
Okay. So that £247 a week shortfall going to 3 million plus is a very significant funding gap.
It is, and I wonder how we even exist.
I was just going to say that.
I don't know. And if I have to ask myself, I think we do everything on a shoestring, and we really rely on goodwill. People do so much more above and beyond. You know, people stay after their shifts. You know, the salaried management staff do way more. And that doesn't feel fair. It feels like we're exploiting the goodwill of the people, and it's just not okay, really.
Anita, any difference in your world?
No, sadly, it's the same. I think it's the same across social care. And I think the difference is that 2/3 of the people that we support are funded through NHS funds, but the underfunding exists there. There's a proportion, so probably about 12% of the funds that we get each week has never changed since 2013 in Nottinghamshire. You know, if you think that element never changes, it's a huge amount when you look at the number of years. So if we look at the 10 years that have gone past, 12% of the fees has never changed, and never had an increment. Even though the other element of the fees has had an increment, it's never enough. It's never in line with inflation. And if we don't keep up with inflation, then we're not going to be able to maintain our services. People are going to get frustrated about not being paid fairly for the job that they do, and then they'll walk, and then we'll be nowhere.
So let's just unpick that point about people who get support from NHS funding. It might not be very clear to our listeners how it is that the NHS is paying for care in a non-NHS setting. So do you just want to explain a bit about, what it is, in essence, that kind of medical clinical care that you're providing, but in a homely setting out in the community, away from an acute ward or a community hospital?
So decades ago, the NHS used to have long-term care wards. But because of funding issues and because of resource issues, so staffing, etc., it was deemed that was no longer affordable. And so long-term care was then contracted out to care homes, predominantly for older people, but it does also exist for younger people and people with learning disabilities and autism. So care homes, particularly care homes with nursing, are funded through the government, through the NHS, to provide funded nursing care and also to provide continuing health care, which is where individuals who have a primary health care need are funded through the NHS.
Technical explanation there, but some people don't quite understand the different elements of the way that society supports people with different care, support and medical needs. Can we go back to the staffing challenge? Because we know that a lot of care workers are paid near or just above the minimum wage. And we know that it's not just money that matters. We know that other things matter to people, but money really does matter a lot. So in terms of maintaining your staff and thinking about the ways that you inspire them to stay with you and the wider things that might help, do you want to just tell us a bit about how Chef Care think about it? Because I know you've spent a lot of time exploring how you attract staff, how you recruit them, and then once they come to work with you, how you keep them.
People don't come into this job for the money. When I ask staff, why do you do this job? You could go and work in Amazon and earn more money. And they just say, I love the residents. So we're really lucky. People do it for the right reason. That doesn't mean it's okay to underpay them. So we try and be a good employer. So listen to them, build a sense of team. That sense of teamwork is really important in a care home. We do things that aren't expensive, like we buy them daft gifts, advent calendars, Easter eggs, key fobs, just to say thank you. They know we haven't got a lot of money. We can show appreciation. So we try and be as flexible as we can be, but that's not easy when you're running a service that's 24/7, 365 days a year. There's long shifts, unsocial hours, but just trying to appreciate people. But it is hard. It's a hard job. And the bit that I think they struggle with the most is it's just not valued. And they always compare themselves to the NHS. So I say to people, what would you like to see different? And yes, it is more money, but they'd like the respect that they should have. People love the NHS. It's really well regarded. It's really well respected. And social care just feels invisible. We don't have that brand identity. And it's a shame because they're really skillful people doing a really important job and they're proud of that job. And I just love to see them recognised for that.
So that's a challenge for all of us in the sector, isn't it? How we build the value of the social care brand. Because I think that comparison with the NHS is actually really important. And even though people don't really understand how the NHS works, they probably don't understand that a lot of GP surgeries, for example, are privately run. They don't really understand all the different bits of the NHS. They have an affinity with it when they need it at different points in their life. And perhaps, Charlotte, in a little while, we might explore how some of our key partners and stakeholders, like the insurance world, who were very prominent during COVID, might help us.
I think it's just that understanding that social care is actually bigger than the NHS as well. There's that misconception that the NHS is this big, overarching brand that we see. And actually, we have more workers and we're caring for more people. So there isn't that understanding, that recognition as well. And I think sometimes the data doesn't show what's actually going on for us. The data is leaning towards that NHS data, which is put in the media. So there is a general misconception.
We could have a whole other discussion about data,
yes, we could.
data and digital. One of the simple lines that we often use to try and explain the difference is that in your life, the NHS might fix you, but social care will help you to live your life. And I think maybe if there's something we could do to gather a bit of public support around the importance and the impact that social care has for millions of people every day, I think we might be able to move it to perhaps further up the political agenda. And given we've got a general election looming, something we might want to think about. So Anita, in terms of staffing and that whole question of, the service is only as good as your staff, and your staff need that as well as paying. They need that inspiration, that motivation. I know you've done some interesting work in thinking and listening to your staff about what will really make them keen to stay.
Many of our staff come into care because of their caring nature. They want to work with people, they want to support people. But often what they're flabbergasted by is the continuous professional development, the learning that is ongoing that they're faced with. And for many, when they may have left school with minimal qualifications, they find that quite daunting. What we've done is we've supported them to learn on the job, but we've made it fun, we've made it interesting. It's not just talk and chalk, it's not just death by PowerPoint, it's about making it real, involving people that are of interest. So we'll get people to come and talk to them about what it's like to live with a condition, or we'll get people to come and talk about what it's like to care for a loved one and the challenges, or we'll get staff who have started off as care assistants with no qualifications that are now advanced nurse practitioners, that have moved up and progressed their career. So we'll get all of these people to come and talk, but what we're actually doing is making it real, making it achievable, that they can see, actually, this is within my reach and I'm going to be supported by this organisation to be able to attain it. And once we've done that, it's had great benefits. We've got staff that have continued to work with us, that our organisation's 34 years old now. We've got staff that have been with us those 34 years that have progressed from no qualifications now to being the clinical nurse or the dementia nurse lead. We've got people that are now head of HR that have just developed and gained those qualifications through the organisation. As Claire said, it's about valuing people's opinions, listening to them, taking them on board and actually giving their ideas a go. And then once you've done that, you gain added trust and commitment from those individuals.
So a lot of growing your own.
Definitely growing your own.
Yeah. And actually, I probably should have mentioned this to you earlier, but the government is interested in some of our ideas about particularly how we might expand social care nursing. So we should talk about that at some point and what might help. I'm firmly of the view that if there was a way to support nurses during their training to have a placement in social care more broadly, so that many more trainee nurses had some time in a care setting, doesn't matter what sort of care setting, actually, but had a sense of what social care looks like, feels like, is like, we might have a much better take-up of nursing in social care.
Yeah, I think we would, but I think there is something that we need to address, and it's not just the pay. The way in which our staff are treated by colleagues that are working for other organisations, and I'm talking about statutory organisations such as the NHS and local authorities. There seems to be a view, because they're working in social care, that they're not comparable in terms of knowledge, skills and expertise. Andrea Sutcliffe, who's the registrar and chief executive of the NMC, when she took on that role, she highlighted that social care nurses were exactly the same in terms of knowledge, skills and competence as their NHS counterparts, and should be treated as the same. And I think as a sector, we need to do more around how we raise the profile of our staff, but also how we challenge when bullying, harassment, undermining takes place, because it's not acceptable.
I think that's a whole other topic. But from everything we've seen recently in the news, there's definitely something about some of the culture in some parts of the health system and how seriously it takes its clinicians more widely, actually, isn't there?